Welcome to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. Today, I have with me two friends, two surgeons from Nigeria, whose voices will hear about their experience with the recent virtual annual clinical congress, Drs. Oyintonbra F. Koroye and Adeyinka Adejumo. Welcome, gentlemen.
Thank you, sir.
Thank you, sir.
Well, let's start out first, if we might, with Dr. Adejumo. Had you ever had the opportunity to come to the United States in person to participate in one of the annual clinical congresses?
This is my first time of attending the ACS Congress, and it turned out to be a virtual one. I just got initiated into the American College of Surgeons just last week, and it's a great honor to be here. I've never been to other conferences before. This is my first time.
Well, congratulations on having been initiated. We're delighted to have you amongst the fellows of the American College of Surgeons. If the Congress had not been virtual, would it have been easy for you to travel to receive your diploma in person as an initiate?
I actually had it in plan to travel down to the US for this conference. I've been working towards it. I've been saving towards it, but unfortunately, the COVID-19 pandemic came in and the conference had to be virtual. But actually, I had planned to attend in person.
But it took some time to save the money and plan to do it.
Yeah, it took some time, really. It took some time, really.
Did you find it overall to be beneficial that you were able to save that money for something else and participate in the Congress in a virtual sense?
Yes, it was beneficial at the end of the day because we have to channel the money, probably maybe in attending the Cleveland Clinic Loretta Symposium next year, hopefully. But actually attending the virtual conference was worth it. It was worth it as I learned from different panelists and different sessions of the conference.
Thank you. Dr. Koroye, could you tell us a little bit about your practice environment in Nigeria?
I'm a general surgeon and I'm into academics. My employers are the Niger Delta University, where I work as a lecturer. And I work as an honorary consultant general surgeon in the Niger Delta University Teaching Hospital. It is the premier hospital of my state, Bayelsa State, in the southern part of Nigeria. It's not very large. It's about a 200-bed hospital, and we provide tertiary care to about the state population of about 2 million people.
Thank you very much, Dr. Koroye. Could you share with us your impressions of the virtual Congress, specifically some of the lessons learned and information gleaned, which you're able to bring to your practice at your hospital?
I'll just give a little background. This should be my 6th clinical conference, which I'm attending. And of course, the previous 5 have been in-person meetings. The virtual meeting I found quite interesting. The key thing, the key benefit of this virtual meeting is that though we are separated, it managed to connect a lot of people. From the figures, I see that there were about 30,000 attendees. If I'm not mistaken, I don't think we've ever had such a number attending a clinical congress in the past. Being virtual and most importantly, being free meant much more people could connect to and benefit from the educational programs of this Congress. People who otherwise would not have been able to make the journey to the United States and pay the fees for registration for a clinical Congress. So I think that is one big benefit of this virtual Congress, giving education to people who otherwise would not have been able to afford it. I come from a low or medium income country, and making the trip to America and registering for the clinical Congress, it's not, it doesn't come easy for even established surgeons. So I think this is one of the benefits of this virtual Congress. I think moving forward, they may want to consider making it a hybrid, even if we eventually get back to the in-person meetings. I would want to suggest that there should be some hybrid where other people who cannot readily afford coming to the Congress can benefit from this knowledge.
Thank you very much, Dr. Koroye. And to turn back to Dr. Adejumo, could you first start by telling us what your surgical practice is like, what kind of surgery and where?
I work as a general surgeon at the Federal Medical Center, Keffi. Keffi is just a 30-minute drive from the nation's capital city, Abuja. And where I practice, it's actually a full hospital practice. I'm not affiliated to a university, actually, though that doesn't stop me from carrying out my clinical researches. Essentially, I see a lot of patients here because most of our patients that do present to this center are low-income earners. So they are those patients that cannot really afford the high cost of hospital practice in the main city. So they come here, and we see diverse patients here, ranging from benign lesions to malignant lesions. And topmost on my list of patients that I see are breast problems, followed by colorectal. Colorectal diseases and cancers form about 40 to 45% of the patients I see in my practice here in my hospital. We treat them accordingly, though we have limited resources, but with the little local protocols we have established to detect these lesions early and manage them accordingly, we've been getting some good results thereafter. And I have also been networking with some other surgeons in other nearby hospitals and collaborating with them on ways to foster our practice in a multidisciplinary approach. So we created a forum where we invite these professionals who co-manage patients together with us, and when need be, to refer to other centers for further management, we do so accordingly. So far, the practice has been challenging, but we've been able to cope with the trend of events, and we are getting some good results despite our limitations and restrictions.
Thanks very much. Given some of the challenges you have and the type of practice, what did you find helpful from the recent virtual annual clinical congress that you're able to bring to your practice?
This clinical congress has been quite helpful, and there are 3 sessions I would like to applaud. The first session was the opening speech by the president, Dr. Meredith. It was quite inspiring when he actually talked about our responsibility to our patients, our family, and also address some racial issues that is trending now. Most importantly, he talked about service to go through humanity. Secondly, I enjoyed the session of colorectal cancer screening handled by Dr. Haladi, as he talked about some technical aspects of managing colorectal diseases and cancers. The third session that was quite inspiring was a session on conflict resolution in the operating room among different professionals. This is a session that I have gone back to watch and read over and over again, and I think what I have learned there, I will transmit down the line to my colleagues so that at least this will foster our practice in this environment. It's quite a very interesting virtual meeting, and I really applaud all the participants and the presenters.
Thanks very much, Dr. Adejumo. Dr. Koroye, you already mentioned you hope that the conference stays in a hybrid format so that more people can participate. In your conversations with surgeons, not only in your area in the South, but Lagos, Abuja, Kano, wherever you chat with people, did you find that the overall Nigerian surgeon attendance was higher than it would have been had the Congress been in person in the US? Did more people participate who hadn't in the past?
I would think so. I didn't do a personal survey, but from my own area, I actually succeeded in making more surgeons tune into this Congress. I was able to encourage about 3 residents, and I am also aware that about 5 other consultants also participated in the program. If this were to be how the Congress used to be about a year ago, I don't think they would have had the opportunity to partake in this Congress. And I think I'll make bold to say that more surgeons generally logged on to this Congress compared to previous Congresses.
Yeah, indeed, our registration was probably more than triple what we would normally see as an in-person attendance at over 31,000 registrants for the various sessions that we had. And of course, there is the possibility to view additional content. So I'll ask Dr. Adejumo, do you think that you'll be going back to look at some of the sessions if you kept them on your playlist, kept them as access to continue to watch some sessions as time goes on over the next few months?
Yes, I have a plan to do that. In fact, this week, I think I've gone back to view 2 sessions that took place during the Congress that I wasn't opportune to meet up with. I have plans to keep watching and going through those sessions, definitely, before the 31st of December.
Excellent. And Dr. Koroye, I see you nodding in affirmation. You've got a list of sessions you want to see?
First of all, let me address one of the advantages of this Congress is that the attendee could pace himself over sessions you want to attend. And I think that is one big advantage. There are a number of videos which I have put on my playlist, which I intend to see. And this I'll continue to do for some days or even weeks to come. So again, that is one other advantage of the virtual over the in-person Congress. The fact that you can pace yourself and attend your sessions as you would want. So that's a very big advantage. Some sessions which I found particularly interesting were the medical and residence education program, which was anchored by, organized by one of my other mentors, Dr. Sachdeva. Being a teacher, I found that particularly interesting. I also always enjoyed the ceremonies of the ACS clinical congresses. So I hooked up to the convocation ceremony, even if that was at 2 a.m. at night. I think the organizers did a good job in simulating the actual convocation ceremony. I also watched the opening ceremony, which again was fantastic. Kudos again to the organizers. I'm a stickler for surgical history, so I didn't miss the surgical history sessions. Again, that was of interest to me, especially the one that had to do with the development of the Gray's Anatomy textbook, where surgery came face to face with technology. I found that particularly interesting. I also enjoyed the COVID-19 sessions, especially those that had to do with the perspectives from international fellows. So those are some of the, as well as the video sessions on the hot topics in general surgery. Those were, I found particularly interesting. And like I said, the Congress is not over for me yet because I still have a playlist which I would thoroughly listen to and watch.
Thank you, Dr. Koroye. And last question for Dr. Adejumo. So congrats again on becoming an initiate. Did the fact that the Congress occurred in a virtual sense and more surgeons participate, do you perceive that more West African surgeons, Nigerian surgeons are going to look to become fellows in the college and participate in the college activities?
Yes, I am very much optimistic that many more people will be interested and participate because from my initiation and becoming a fellow of the college, it has actually brought into limelight the importance of the American College of Surgeons among my colleagues where I practice. And I'm sure once given the opportunity, or probably once the coast is clear of this pandemic next year, I'm sure that many people will love to participate, just like what Koroye said earlier on. The awareness is already there. We are already telling people about ACS and the benefits. And I'm sure that many more people will be interested in joining and attending the conferences.
Well, thank you very much, both Dr. Koroye, Dr. Adejumo, for your time and your insights, and thanks for being wonderful ambassadors in Nigeria for the American College of Surgeons. I wish you and your families continued health through this pandemic, and look forward to seeing you in person, hopefully at next year's annual clinical congress, if not sooner.
Thank you very much, sir.
Yes, sir. Thank you for the opportunity, sir. I also learned that you were just elected as the vice chair of the board of regents of the ACS, and I want to congratulate you for that, and also thank you for the wonderful mentorship which you've been giving to me and my brother, Dr. Adejumo. Thank you very much, sir.
Thank you. My pleasure.